Hi, and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today on the show, we have Supriya Rao. She's a gastroenterologist and an expert in obesity medicine and a connection between diet and the microbiome. Supriya, welcome to the show.
Thank you so much for having me, Kevin. It's great to be here.
So I was wondering if you could start by sharing your story and your journey to where you are today.
Sure. So, like Kevin mentioned, I'm a gastroenterologist and obesity medicine specialist. After going to college and then doing 4 years of med school, I found myself drawn to internal medicine. So I ended up doing a residency in internal medicine at University of Pennsylvania. And while I was there, I was trying to determine, what to specialize in or just stay general. I actually really enjoyed my ICU time at Penn, and so I was thinking at some point maybe doing pulmonary critical care, but then I also did a few GI rotations and really loved the mentors that I found on GI, and specifically one who was really like one of those master clinicians and really made you feel excited about learning. And after my time with him, I figured, and actually people in GI have a pretty good sense of humor and they seemed kind of laid back. So that's why I decided, let's try GI. And I also really like the procedural aspect of it. So I ended up applying for GI fellowship, matched at Boston Medical Center, and had 3 years there, which was great. It's a really great program, especially for if you're interested in doing mainly clinical medicine. And so, while I was there, I learned, the ins and outs of the procedural aspects of it and all the different, medical issues that come with GI, a wide range of things, ranging from issues with the esophagus, the stomach, the pancreas, the liver, gallbladder, the large and small intestines. So it really spoke to me. It was a broad range of internal medicine, which I still really like to keep up. And then after I graduated from fellowship in 2014, I went into prior practice towards the end of 2014, and I worked north of Boston in a town called Lowell in Chelmsford, not too far from you. And I have been there now for almost 6 years and really love it. I have I was really, kind of struggling and grappling with the decisions of going into prior practice versus academics, which I had been in my entire life. And I really felt, worried, am I not going to be able to keep up that high level of academic, knowledge and everything. But the group I joined is very talented, super academic group. Our whole goal is to bring tertiary care medicine to the community. And so we offer pretty much everything a GI program at a large academic center in Boston would offer. And I was able to build up their esophageal motility and GERD program at the hospital from the ground up, which I wouldn't have been able to do had I gone into a place where it was already existing. And then I also built up more of the motility program. And then as time has gone on, and I'm sure you're seeing in primary care, Kevin, there are a lot of patients who come in with fatty liver and their liver enzymes are elevated. And, I was just telling these patients, okay, you need to lose weight, diet, exercise. But obviously that wasn't really giving them the tools required to actually do something about their weight. And so I decided, a couple of years ago, I thought, I really need to be able to give my patients, more than just a handout on what a good diet is. So I started, I went to Harvard's Blackburn course in obesity and did another few courses, did more CME, and then became board certified in obesity medicine. There's a huge intersection with GI and obesity, as there is with endocrine and surgery. There's a lot of overlap. Obviously, obesity is, the root cause of a lot of chronic medical issues that we see in the US. And so, 40% of the US population is obese. So it's definitely a problem that we're facing head on as we move forward in medicine.
So what you said earlier about the diagnosis of fatty liver really strikes a chord with me because I see so many cases of that.
Right.
So what kind of advice do you give to these patients other than eat healthier, lose weight? What's your approach to obesity for your patients?
Right. So when I first see a patient, when they first come in, we kind of sit and talk about just like what, if they've ever had excess weight issues or been at an unhealthy weight, or what, they're already self-selecting themselves for coming to me. So they do have some level of motivation to come talk about, and don't feel embarrassed about it or don't feel worried about it. And so I talk, you're on all these medications. A lot of them, their motivations to get off some of the medications and just want to be feeling better, or, their kids are still young and they want to be able to run after them and keep up with them and not be tired all the time. So I kind of want to get behind the motivation as to why they're doing this. If it's obviously to fit into, some X number of size, like that's a goal in itself, but I want to kind of push further and really understand why they're doing it. Because for me, I don't want patients, I don't care about people looking like models and stuff. I'm caring more about their chronic medical issues and being able to prevent those as time goes on and to be able to get people off their medications. And so I talk about what their diet is like, what exactly are they eating? Can they give me a 24-hour recall, a 2-week recall over what exactly they're eating during the day, and what times they're eating? Do they eat for emotional reasons? Is there any behavioral aspect to their eating? What kind of activity they do, how good their sleep is. Sleep is so important because it's one of those things that people still really discount as being important. They don't think that proper sleep is something to be concerned about. But as we know, if you get less than 7 to 8 hours of sleep, you're really going to set yourself up for more chronic medical conditions, including heart disease, sleep apnea, all these issues kind of rear their ugly head. And, I feel like you can do everything perfectly, but if you're not getting this certain amount of sleep, it's not really going to work. Certain hormones get upregulated because our body thinks we're in a constant state of stress if we don't get enough sleep. And so we talk about sleep hygiene, we talk about stress management. So it's kind of like a full lifestyle discussion about what exactly they're doing. And then we kind of start tackling each one by one and what improvements we can make.
You're also an expert in the connection between diet and the microbiome. Now, why is that connection important for patients?
So the microbiome, there's still a lot that we don't know about it. Obviously, there's been a ton of research, but there's still quite a bit we don't know. So the microbiome is basically this ecosystem that resides in our small intestine and our colon. And it's about hundreds and trillions of bacteria that are present. Anywhere from 1,000 to 1,200 different species of bacteria are present. And it's really important in vitamin synthesis, fermentation of carbohydrates, maturation of the immune system. So our microbiome is starting to be determined from when we're young. And if we don't treat it well, it can possibly lead to issues with chronic medical problems later on, specifically autoimmune diseases like celiac disease or IBD, like ulcerative colitis or Crohn's disease. So having a healthy microbiome is super important just for our overall health and chronic medical conditions. So if you are eating a diet that's high in saturated fat, high in processed meats, high in animal products, low in fiber, your microbiome is not going to be very diverse. It's not going to be treating you well. You're going to have issues with gut motility. So that's why the American Cancer Society just came out with their guidelines a couple weeks ago about what your diet should be. And it's becoming more frequently seen. Mediterranean diet. The blue zones also kind of promote a plant-based, overly a plant-based diet. High diversity in fruits and vegetables, whole grains, low amounts of animal products, good social support. All of these things are really important in ensuring a healthy gut microbiome. And so with your microbiome being healthy, your body will be happy, your motility will work properly. So there's a lot of things that are predicated upon a healthy microbiome.
And from a primary care standpoint, is this something that we should screen for? What are some tips that you could share with your primary care colleagues?
I know it's hard in primary care because there's so many things that you guys have to really think about and make sure that the patient is doing already. So I would say just having a quick discussion, especially if you notice that they're at an unhealthy weight, just have an initial discussion with them about it, because I think a lot of people don't even broach that topic because they're too scared. But as we need to treat obesity as a chronic medical disease, a chronic condition, and not something. The unfortunate part of it is it's tied to a cosmetic thing, and so people are so nervous about talking about it. But it's a disease just like blood pressure, diabetes. High blood pressure, diabetes, high cholesterol. It's similar in that sense, and we have to treat it as such. And so we need to broach the topic with patients, really understand, the United States, only 3% of the population truly gets the amount of fiber that they should be eating. So I would say to the primary care, trying to encourage people to increase the amount of fiber in their diet from food sources. Taking dietary supplements is one thing, but if they can increase the amount of fiber from their food itself, you're going to be much healthier.
And what is the role of probiotics in all of this?
So probiotics, they're a multi-billion-dollar industry, and for a long time people, and even today, people think, oh, they're going to help me, they're going to help kill the bad bacteria and populate the good bacteria. The problem is that there's not great evidence to back probiotics necessarily. In certain cases, they are helpful. So if you have ulcerative colitis or pouchitis, it can be helpful in those conditions. And also sometimes post-infectious, I'll have my patients be on a probiotic for like a post-infectious IBS syndrome. But in general, they're not that helpful. It's much better actually to eat prebiotic foods, so which are foods that are high in fiber. Prebiotics, what happens is with those fiber foods, they come into your gut. They then the bacteria in the gut ferment that fiber into short chain fatty acids, and then that leads to increased resilience in the gut microbiome and improves the overall health of it. So I would say more important than taking a probiotic supplement, eat foods that are high in prebiotics. So things like leafy greens, leeks, kale, like a leafy green, onions, garlic, lots of different fruits are high in prebiotics. So that fiber is super important. And also probiotic foods. So if you eat fermented foods like kimchi, sourdough bread, kombucha, sauerkraut, all of those are actually much better to eat than, I would say, a run-of-the-mill probiotic supplement.
Regarding that connection between diet and microbiome, at what point do we refer out for consultation with a gastroenterologist like yourself?
So I would say if a patient is having symptoms of like bloating and just overall, changes in bowel habits, you can try some of these things. Actually, a lot of patients, I tell them to stop dairy because as a species in general, we are lactose intolerant, and those who have evolved to be able to handle dairy more are actually, I guess, quote unquote mutants. But, overall dairy, large amounts of dairy aren't great, but as a society, we do eat a lot of dairy. So for primary care, try cutting out dairy for a few weeks and see how patients feel. But if they still have persistent symptoms beyond that, and you've tested them for celiac disease or small bowel bacterial overgrowth, then at that point I would refer out for possible, endoscopic procedures or any further workup.
Now, to switch topics, we're speaking in the first week of July, and COVID-19 is flaring up in parts of the country like the South and the West.
Right.
Can you share some of the GI manifestations of coronavirus that we should look out for?
Sure. In China, there have been some studies of GI manifestations, even without respiratory symptoms at all. And so the main one is diarrhea. And so actually, I think the CDC and the WHO have put it as one of the main symptoms for COVID. So diarrhea, nausea, vomiting, loss of appetite, these are all possible signs or symptoms of COVID. The problem is they're super nonspecific. So someone doesn't have respiratory symptoms and they have the GI symptoms, they may not seek attention as fast as someone who has shortness of breath because they may think it's maybe food poisoning or something else. So definitely need to keep diarrhea as on your kind of list, just because sometimes delay in care happens because we're not going to the emergency room or seeing your physician as quickly. It's really hard because patients with IBS or patients with Crohn's or colitis, it's really difficult to kind of piece out, Is this COVID? Is this IBS? Is this IBD? So make sure you speak with your primary care or your gastroenterologist about it. And there's been some endoscopic findings with COVID in patients with rectal bleeding. And so they find that there's either hemorrhagic colitis or segmental colitis, esophagitis, or gastric ulcers, which may speak to kind of like the thrombotic nature of COVID causing kind of ischemic colitis. So it's definitely a lot of possible GI manifestations.
Sure. We're talking to Supriya Rao. She's a gastroenterologist in Northern Massachusetts. What's your take-home message for the Kevin MD audience?
I guess my take-home message is, we're trying to, in this era of COVID, everyone's trying to be healthier, everyone's trying to do the right thing for themselves. And I think as long as you are paying attention to what you're eating, your sleep, your mental health, all of these different aspects as much as you can, whatever you can. I know it's a very stressful time, but whatever you can do to pay attention to those aspects of your life and try and improve upon those, you're going to see it pay out in spades as time goes on.
Well, thank you so much for your expertise and insight, and thank you so much for being on the show.
Thanks for having me, Kevin. It was great to be on.